So that on the slide we saw earlier, it said when nursing interventions to check CBC or complete blood count to see if there has been any damage to the blood, and if so, how much.
So are they looking, when they check the CBC, are they looking for an imbalance then?
Right. We're looking for normal. That the normal components of the blood should be there. That's what they're looking for. And then hoping that that's what they'll find. And if they do have any kind of imbalances, they have to either support that with intervention or draw back the medication. And you'll see it. You see that a lot when we talk about anti-cancer drugs and so forth. Where you have to do the intervention because they are killing off red and white blood cells. And you have to give those different medications in order to boost them. Question?
I have a question. Are you going to ask a lot of questions about dosages? Like normal dosages?
No. Yeah, we're not getting that. We were doing a pharmacology class for medical students, and that's what you'd be. And then your pharmacology class would last a semester, and we're talking 5 to 6 hours per day. Go ahead. We don't have that time. Plenty of information. Trying to keep it as superficial. This, believe it or not, is superficial.
Really?
Oh, I believe.
Yes. This
I believe.
is superficial. If you look at a lot of these, you will see that the side effects, adverse reactions, and what they're used for are very similar. Very similar. So you can take all the information from one slide and cut and paste almost every slide thereafter, because within that category, you're going to see that those same things. You're going to see similar uses, see same side effects, same adverse reactions, and toxicity and so forth will be very similar. And that is one thing to remember, is that when you're dealing with all this, is that if you can look at medication by category, for example, antibiotics, we know that these are side effects these are usual side effects for almost every antibiotic, with some differences. The use, pretty much the same. Now, not for specific bacteria, but pretty much the same as far as bactericidal, bacteriostatic. And then the action, how it works, whether it works in protein synthesis with the DNA, RNA, is similar. Okay, but that falls within that group of medication or that category. Yes, sir. Okay. What's a common name for that?
Page 441. 441, Jordan. 441. That's the word.
Question? Okay. Thank you very much. We got done with that one. Okay. Stand up and wiggle for a minute. We're going to get right into this one. Yes, as our said over here, this is a lot of information. It is a lot of information. What's nice is that you're learning this, you're tested on this now, and it will become even more solidified as we go through clinical, so forth, where you'll be able to pull those out of your head. Right?
Anti-infective. So this drugs that goes against infections. Like TB. You know somebody, one time there was an outbreak of TB. We don't know if it was an outbreak.